Today I'm interviewing Dr Andrew McIntosh, CEO and partner at Lilydale Medical Centre. Andrew, you've worked in general practice for more than 30 years?
Well,
correct?
about 30 years.
About 30
We'll say about 30 years, then I'll really show my age if I go further than that.
So you've seen enormous changes in that period of time. What are the really big issues facing general practice right now?
I think the acceptance of technology and the use of technology by general practice, by other aspects of the medical fields, and also by government, and their perhaps lack of willingness to look at how effectively general practice can now deliver very high levels of quality medicine.
So tell me then, what does good quality, cost-effective care in general practice look like for you?
It's a composite of good clinical skills and integration with the improved technology that we now have at our hands these days, and utilising that effectively, but still maintaining a clinical bias to allow your skill background in medicine and surgery to achieve effective delivery of health services to the clients, patients, whoever they happen to be.
And what are you mostly seeing? On an average day in general practice, what are you dealing with?
I would say you deal with everything. That's really a dichotomy, isn't it?
Right.
A good general practitioner has to have a broad base and great knowledge and understanding of medicine in all aspects, and not just be an expert in one area. And they have a very difficult task in keeping up abreast of those these days, but I think most general practitioners do, and they're very good at it.
Is it getting more complex clinically?
So I think it's very different. And so these days, very much in many of our consultations, we're taking the role of a general physician. Whereas 20, 30 years ago, there was a general physician who did this stuff. But general physicians are no longer an animal that lives and walks the planet. They've been replaced by specialists in particular fields. Subspecialties now rule the consultant areas, and general practice now has to fill that role of a general physician, and providing a level of service that's much more sophisticated and aided by the level of sophistication of our clinical tools. And also level of pathology. We have a laboratory as well as a major laboratory on tap, which within 24 hours we can have most results. I believe that general practice medicine in Australia delivers a very high quality outcome for their client base, patient base, and continues to. And I believe that training is underlying general practice these days, substantiates and warrants further investment. And certainly it should be maintained and not devalued and derided, as it seems to be a favourite game of most politicians, or many politicians, particularly on the economic side of things. And they look at costs, and when you compare the cost of general practice delivery of health to that of specialist medicine and hospital medicine, then the efficiencies are far greater in general practice than are delivered by the complexities of specialist and hospital medicine.
Why does the community love their GP?
Because general practitioners provide a level of communication and service that covers both the medical and personal aspects of their life, and that's very important in overall health delivery.
So Andrew, you've been involved with Medicare locals, with their predecessors, divisions of general practice, and now with primary healthcare networks as they get rolled out.
Yep.
With all of those iterations of support for primary care in the system, what are the things that you think we absolutely have to keep? And conversely, what are the things that we need to drop and start anew?
I think there has to be a greater facilitation of interaction between these allied health delivery entities, or supporting services, which they are, and general practice. So I think we should be looking to help with greater facility. I think certainly more support in allied health as part of a PHN as we roll into PHNs. I think it should be a supportive role between general practice, a facilitated role, and coordinated in delivery of health services, and taking some of the patient load out of general practice, or assisting in some of that patient load, will remain an absolute role of importance of PHNs. So I think there's a great role for PHNs, and with the clinical councils facilitating some of the work that PHNs will bring about, then I think there are directions that we can achieve in health and outcomes that probably will be never realised before. So I think there is a great future for PHNs supported by appropriate clinical expertise and advice to achieve very good outcomes in health.
So how then do you as an individual GP or your general practice, how do you get your needs known and met by your local PHN?
I think we have to make a concerted effort to achieve an input into the PHN and have representatives discuss with and talk with PHNs, and particularly with the clinical councils, because that's where ultimately information will be able to be fed through to the boards. And boards will make decisions, hopefully, in accordance with advice that comes from those clinical councils, because they're going to be collecting a broad base of information, not just in theoretical and evidence-based medicine, but also from the community at large, and that's going to be their role. And I think the medical community and the public community will be a very important source of information and leading the direction of where PHNs and clinical councils direct their expertise.